Cardiovascular health and integrative approaches.
So welcome back to our channel, and if you want to find out how this helped your heart, stay tuned.
My name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri, and this is my wife.
I'm Dr. Jennifer Sue. I practice private practice OB-GYN, and quickly it's going to turn into just an integrative medicine office with conventional gynecology.
How to improve cardiovascular health using integrative approaches.
We upload 1 to 2 videos a week about health issues, and we treat them with an integrative medicine approach. If you haven't subscribed, please do so, and if you like our video, give it a thumbs up, hit the notification bell so you know when we've uploaded a new video.
This is a subject that's near and dear to my heart. I just had a stent placed about 4 weeks ago. So in the months to come, I'm going to be showing you how my blood values have changed with certain interventions that we're going to be using.
Remember, stay tuned to find out why beer is involved in your protection of your heart. We're going to talk about 12 integrative approaches to cardiovascular health. Sounds like a lot, but we'll go through them quickly.
First of all, I just want to provide a little bit of background. In spite of all the advances we've had in medicine, cardiovascular disease is still one of the major causes of death in the United States, and the majority of those events are preventable. Unfortunately, a lot of people don't discuss it, or they actually even know about it. One of the most important things that people need to understand is what triggers the cardiac event. Everybody thinks that vessels in the heart would slowly start to get smaller and smaller due to plaque or what they call atherosclerotic disease. You have a lot of people even that had cholesterol levels that were below 200 started having heart attacks. So they started to think, well, maybe there's another reason this occurs. And one of the reasons is it doesn't just have to do with the size of the narrowing in the heart, but the type of plaque that's in there. And we're going to discuss that a little bit as we go along and how we address as integrative medicine. Now, nutrition I bring up in almost in every conversation I have with my patients, and it's important even in most chronic diseases, including heart disease. They did a study, it's called a LYON study, L-Y-O-N, where they took some of the most well-known cardiac-friendly diets and they compared to what is called a Mediterranean diet. And you can look this up on YouTube. It's an amazing and powerful diet. And they actually stopped the study because the people that are in the Mediterranean diet were doing so much better. The beneficial effects of the Mediterranean diet carried on to even 5 years after they started it. And basically, the tenets of it is very little red meat. It's not a vegan diet, but a plant-based diet with a lot of fruits and vegetables. Nuts are very, very important in this diet. You substitute meat if you can with chicken and fish preferably. And then they also noticed that people who ate what they refer to as unrefined whole grains. So if you ate grains and bread that was pulverized, it didn't have the same effect. So you really had to have like the boiled forms of the whole grain to get the actual benefit from it. Not only did it help with secondary prevention, but also help with primary prevention. So the difference is that not only does it help people who've already had known heart disease, but it also helps people who had high risk factors that have not had any cardiac event, so that it's important for both of those groups of people to get on a really good diet. Exercise. Now everybody seems to know that, but there's really a lot of good evidence that shows that when you do at least 30 minutes a day or 140 minutes a week, it's not just aerobic exercises. Alternate with aerobic and resistance training as well. It doesn't have to be heavy resistance, but at least some type of resistance training, because it's actually good for your bones and your muscle tone as well.
Give an example of resistance training.
Well, resistance training could be with just free weights. It could be bands. It could be with machine. You really should actually incorporate, as we get older, incorporate some flexibility training as well. It doesn't have to be very fancy, just make sure you stay on the same type of program and do it consistently.
And it keeps you looking good like him.
Now I get this question a lot, even in my own clinic. It's like, well, I don't like taking the cardiac medications, and I've had the heart attack, or my cholesterol's high. Is there anything else that you would recommend? My advice to everyone is, if you are on this medication, stay on it. There are a lot of good studies that show that these things work unless you can't tolerate them. and we're going to discuss that as well. But there's a lot of different drugs that are out there, what they call beta blockers, calcium channel blockers, nitrates, angiotensin converting enzyme inhibitors. Those are all important. And if your doctor puts you on that because you've had a heart attack or you've got a high risk, you need to stay on them. They do have some side effects, however, and we're going to talk about that. One of the most common in statins anyway, which is an important drug to be on if you've had a heart attack and you have documented heart disease, called statins, and sometimes you may be one or even two statins, and these do have some side effects, and probably is at least 10 or 11% of the people who get started on them have muscle aches. One of the best ways to counter that really is to reduce the dose of the statin. So there's strategies to help reduce it. Your cardiologist or your family doc can help you with that. Do not stop the medication because it's extremely effective and it's got one of the best studies out there at the moment. Called lipid management. Everybody is very, very focused on total cholesterol. And unfortunately, as I mentioned at the beginning, a lot of people that had cholesterols below 200 had heart attacks. In my case, I had angina and my cholesterol was below 200. So it's important not just to look at that, but something called LDL. LDL is low density lipoprotein. Not only is it the level of it in your blood that's important, but it's also the type of particle the LDL is. The smaller type of LDL, the small particle size LDL, are the most dangerous. Next thing is HDL. You want that to be high and you want the LDL to be low. You want the HDL to be high because it does impart some cardioprotection. So it's not just cholesterol. When you ask your doctor, if you think you have heart disease, you should have some knowledge about what actually the composition. I'm going to get my panel drawn here in the next month or so, and I'm going to present it on YouTube and let everybody see what my comparisons are and see how they change as time goes on.
Back in the 1980s, American Heart Association recommended a low-fat diet, and that has changed some since then, which is good, because it's not that you need to eat a low-fat diet. There are good fats that actually help you to lower the bad cholesterol and increase the good cholesterol, which is called the HDL cholesterol. The important fats to eat are the monounsaturated fats, which are olives, olive oil, canola oil, most nuts like almonds and walnuts, and avocados. And what they do is they actively lower the LDL cholesterol and increase the HDL or good cholesterol. Polyunsaturated fats are really good. Those are fish, like he mentioned, that are high in omega-3s, soybean and safflower. And these lower the LDL bad cholesterol and they raise the HDL good cholesterol. The ones that kind of go both ways are saturated fats. These are a little bit trickier. These are red meat and real butter, coconut, and dairy products. So what these do is they do some good. They increase the good HDL cholesterol, but they also increase the bad cholesterol LDL. So that's why he said to limit those. Now the worst fats are the trans fats. They actually raise everything bad and lower the good. So they increase the LDL cholesterol, they raise the triglycerides, and they lower the HDL good cholesterol. And these are things like margarine, vegetable shortening, and partially hydrogenated oil. So it's no longer that we need to eat a low-fat diet to keep our heart healthy. It's like what he said, it's the right kinds of fats that we're eating.
And now I want to mention something that Jennifer had mentioned at the beginning of the video, and that is alcohol.
Everybody at this point went boom.
Yeah. Alcohol does help with increasing HDL levels. It's got to be done only in moderation. It's really not a license to drink as much as you want because there are some serious side effects of chronic alcohol use, and we're not condoning that as well. But in moderation, it can be shown to be healthy for your heart.
It's one serving a day.
Yeah. Statin therapy. Some people just simply cannot tolerate the medication, and there's some alternatives if you cannot take the statins or you've decreased it and switched to different brands and they just cannot tolerate them. They include using psyllium, stanol, niacin, and red yeast rice that you can try if you cannot tolerate the statins. These are some alternatives.
But we don't recommend just getting the red yeast rice and using it because you really have to still monitor your blood levels every 2 weeks after you start on the red yeast rice and twice a year thereafter, as long as you're using it, because we have to monitor your liver enzymes and your kidney function.
Next thing I want to talk about is the role of herbal medicine and botanicals in the treatment and prevention for heart disease. Unfortunately, I couldn't find too much evidence, studies out there that show that it is effective, so we're not going to recommend it specifically for this type of problem. Next thing, it has to do with fish oil, and everybody's pretty familiar with fish oil by now. If you're using for cardiac protection, just know that it's used for decreasing your triglyceride level. You really should be taking about 1,000 milligrams a day. Make sure you look at it has both EPA, those are all in capital letters, and DHA.
Very good point.
It's extremely important. CoQ10, I've seen it seems like every time I turn around there's another commercial for another product. It helps with in terms of providing energy in our cells. But what is not known is how it works in terms of cardiac protection. Now, theoretically, if we're taking statins, it should lower our CoQ10. However, the studies have shown that if people that are taking statins,
that's Gia, our cat. She's so sweet. She likes this talk. She's never come to any of other talks. Did she steal the show?
And I just forgot where I was at. A couple of things we need to know about them. One, there's really no good evidence that it shows that it's cardioprotective or it actually lowers blood lipids. But what is known that when you take statins, it does lower CoQ10. However, some studies show that if you take CoQ10 to help with what is called the myalgias or muscle aches from statins, that sometimes that can be effective. So if you're going to try this, 200 milligrams a day is probably a good way to start. Because vitamin D functions very similar to a hormone, not just a vitamin. It's found in the receptor of our muscles and including the heart as well. People that have vitamin D deficiency are known to have increased risk for cardiovascular disease. I would recommend having this checked as well. I would not go ahead and start with a supplement unless you are absolutely sure you need it, because you can actually take too much of it. Folic acid, vitamin B6, and vitamin B12. Theoretically, if you have these vitamins are in your body in sufficient levels, there's a substance called homocysteine, and those tend to be at a normal level. If you have deficiency, the homocysteine levels start to go up. Now, really, what is not known yet is when you supplement people that have high homocysteine levels with folic acid or even B12, whether that does anything good. It could be just a marker, but really not the cause of the problem. So I do that with caution under direction of a physician. Vitamin E. Really, there's no good studies that show that it is effective and in terms of preventing or helping with cardiovascular disease. That may change in the next couple of years, but if you're on a budget and you're buying all these supplements and trying to stay healthy, save your money with vitamin E as long as you have a relatively good diet.
You need adequate sleep every night to keep your heart healthy. It's 7 to 9 hours a night. We're going to actually cover sleep in a future topic as well. All these help with reducing stress. Also reduces anxiety. So it's breathing exercises, biofeedback, meditation, yoga, acupuncture, cognitive behavioral therapy, and anxiolytics. What we always teach you through other videos is how to do breath work. So you already learned how to do the 4-7-8 breath, and we'll have to do a video just on the 4-7-8 breath so you can refer to it. And the other thing is called a heart-centered meditation, and doing meditation every single day, and it's shown in evidence that if people with a history of cardiovascular disease do meditation every day for 4 to 5 years, it decreases their risk of another cardiovascular event by 47%. That's amazing. That shows us that meditation does help prevent heart disease. I love Dr. Anne-Marie Chasson's instructional video on YouTube. We're going to link it down below on how to do a heart-centered meditation. So it's really, really important if you can find what mind-body technique fits your lifestyle and fits your belief system. So don't try to do something that you don't feel comfortable with. Trust yourself.
Thank you everyone for joining us today. And next week we're going to be talking about sleep.
We want to know what you guys are interested in, so please comment below what you like about what we're talking about, what you don't like, what you'd like to hear about, so we get a good feel of what you all need. See you again next time in our next video.
All right, so long.